She told me that neurofeedback had cured her seizures after numerous medications had failed to do so, and had helped her to become sufficiently focused to attend college and get a degree in journalism. The next young woman had been chronically isolated and out of touch with her environment. After neurofeedback training, she came across as vivacious and inquisitive. The third patient was most familiar, a young woman who had grown up shuttled between residential treatment programs, hospitals, and foster care placements, and who, a few years prior to our meeting, had matured out of Child Protective Services, suffering from dissociative identity disorder and chronic self-injurious behavior without any identifiable skills. Young people like her tend to be too confused, frightened, and dysregulated to benefit from most therapy programs, and, lacking more effective interventions, are often managed on mood-stabilizing medications which make them less impulsive but also less able to learn and engage deeply in school, work, or relationships. A bright woman, she described what it was like to have been plagued by chronic noises in her head and an inability to focus on schoolwork, therapy, or consistent relationships because of a disastrous combination of a chronic state of terror and extreme mental confusion. During our 2 lengthy interviews, she gave me the most lucid description anybody has ever given me of what it was like to have been a chronically dissociated, self-destructive, terrified adolescent. Of the many memorable things she told me, one in particular stands out. Yes, I slowly became an attached person. When you are not afraid and confused, you can know people differently. When I asked her to summarize what neurofeedback had done for her, she said, "It calmed me down. It stopped the dissociation. I can now use my feelings. I'm not running away from them. I'm not held hostage by them. I can't turn them off and on, but I can put them away. I may be sad about the abuse I went through, but I can put it away. I can call a friend and not talk about it if I don't want to talk about it, or I can do homework or clean my apartment. I'm not anxious all the time, and when I am anxious, I can reflect on it. If the anxiety is coming from the past, I can find it there, or I can look at how it relates to my life now. And it's not just negative emotions like anger and anxiety. I can reflect on love and intimacy or sexual attraction. Neurofeedback freed me up to live my life the way I want to because I'm not always in the thrall of how I was hurt and what it did to me. I'm not in fight or flight physically all the time." She appeared completely cured, and 3 years after our interview, she graduated near the top of her class in nursing school. Sebern's patients are the sorts of patients who utilize enormous public health resources, usually with very little to show for it. They barely function. These are the treatment-resistant people we know so well and who have inspired us at the Trauma Center in Boston to explore a whole range of unconventional treatments. What Sebern's patients told me was the sort of anecdotal evidence that we need to inspire us to begin a serious exploration of how and for whom these treatments work. I felt in my element. I love to study promising new treatments that have not been tested before, like, over the years, Prozac, EMDR, sensory integration, and yoga for PTSD. Probably the greatest challenge in mental health is how we can help patients with severe affect regulation problems, like those I interviewed at Sebern's office. This usually results from severe childhood abuse and neglect, otherwise known as developmental trauma, in which lack of synchronicity in the primary caregiver relationship leads to abnormal rhythms of brain, mind, and body. These patients are so chronically hyper-aroused or shut down and unable to filter out irrelevant information that they have trouble engaging in whatever they are doing in a focused manner, except when they are involved in reenacting their traumas. Our field has struggled to come up with treatments that can help them to be fully alive in the present without being hijacked by fear, confusion, or distraction, and thus far we have been painfully unsuccessful. As Sebern says in this book, stress never lies with the events that we identify as stressful. It lies in